this. You are now live. You are now live.
I'm gonna put it in the IG and then pin it, and then you can pin it. I'll show you.
Okay, so I see you. Hey y'all. Hey y'all. Hey y'all. Hey y'all. Hey y'all. Oh, we're gonna have so much fun tonight, y'all. Let me tell y'all. Oh, it's gonna be on and popping. We are going to have the girls are gonna have a good time tonight. I am so hey. How's everybody? Hey y'all. All right. So I don't know if everybody ever does it, but I'm over here doing it. We live on Instagram and YouTube at the same damn time. At the same damn time. But anyway, so all right, y'all ready for this? So I know how y'all do, and y'all be all off topic, and that's cool too. I'm going live today um, with something that is very, very serious, y'all. And it is very, very near and dear to my heart. My team is here. West Philly, I see you too. My team is here with me because all this electronic stuff, they're going to be looking at questions if I miss something. I got a couple of different cameras going on. So don't worry about that. But yeah, girls, I am so excited. I hope you guys had a good week. The weather is awful here in Atlanta, so I'm glad it kind of linked up good because most people are going to be in the house, and I'm glad you guys can see this. When I tell y'all are about to be the first to find out something freaking amazing tonight. Okay, y'all are going to be the first. Yeah, I'm just so excited. But the reason that I'm on live tonight is because regardless as to how you voted, that's not my business. Regardless as to whether you wanted a 92% or not, that's not my business either. My job and my goal, straight up off the rip, is to help Black women. And not only Black women. Please don't think that if you white, I'm not trying to help you. If you brown, I'm not trying to help you. That's not what it is. We are a marginalized community, and we are not. We are not. The help is not readily accessible, if that makes any sense. Even though we go to the doctor, even though we have insurance, sometimes some of the stuff I hear, I'm like, who in the hell said that nonsense? Right. And then we get disenfranchised because we try to go to the doctor, we try and get the information, we hear a bunch of stuff, people talk over our heads sometimes, and we just get frustrated. And then that sends us to the internet and to learn all kinds of crazy stuff. And then crazy stuff happens to us. And it's just a whole big damn spiral. Okay. So I want to do my part. Okay. Black female physicians are only 5% of all physicians, right? And sometimes, depending on the personality type, because y'all know, but sometimes that forces us into a space of submission and being quiet in the professional environment, especially on labor and delivery, right? So we need to talk. We need to talk. There are going to be people, and I know you lying. There are going to be people in, I'm sorry, Instagram. There are going to be people in the comments who, I'm waiting for the gram. Hold on, y'all. There are going to be people in the comments who are going to be offended. There are going to be some healthcare workers, some nurses, some young doctors. I don't care. I'm not trying to be liked. I'm not trying to be popular. I'm trying to be heard, understood, and educate you guys in a space where nobody really will and nobody is comfortable doing it. And listen, I own my own practice. I don't deliver babies anymore. I try to do very, 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 very few GYN surgeries. So at the end of the day, it's not a thing for me, right? I don't have to get along. I don't have to go along to get along. So we're going to talk, and I'm going to give y'all the real deal on this stuff, okay? So at the end of the day, let me be very clear, all right? It is not your imagination. It is not your imagination. We're going to start with just basic GYN stuff. Like, I get patients who come in and they're like, do I even need a pap smear? I don't know if I had a pap smear. Like, did she just check me for STDs? Did she check? And it's a communication thing. Guys, can I please, straight up, can I please tell you, if you are with a provider and you leave and you don't know any more than you did when you walked in, that is a red flag. If you are with the provider that you don't feel like you can be like, okay, I got some questions, and those questions get answered, that is a red flag. Okay. Like at the end of the day, your information, your questions, you should be getting answers to the questions that you have first and foremost. Okay. Now, everybody's like, why are we dying? Why are we dying in the Black community? Why are we dying when we go to the hospital? It's like she just went for a simple hysterectomy and she died. She just went for this. I'm going to tell you guys why all this is happening, and I'm going to be straight up about it. Okay. First and foremost, and again, I'm not blaming anybody. I'm not indicting anybody. I'm telling you what I've seen. I'm telling you what it is. Okay. First and foremost, you have a couple of layers in the hospital. You have a nursing layer, and then you have the clinical, the physician's layer. Most often, sometimes depending on the situation, you're going to have a layer in between that. You may have a nurse practitioner, you may have a physician's assistant, depending on what the situation is. You may have a midwife, you may have something in between that nurse and that doctor, but generally it's going to start with the nurse and it's going to end with the doctor for the most part, right? So what we have right now in this clinical setting, in this situation that we're in, what we have right now is a disconnect, right? It's a disconnect. And I am a very proud Gen Xer. I'm a Gen Xer. I'm very proud to be Gen X. Um, and this is a sidebar. I say this because Gen Xers, we work our fingers to the bone. We had a good work ethic. We worked hard. We worked hard. We worked hard. We weren't done until but oh, I was like, you hate coming to my page. We did not stop working until the work was done, right? And to some degree that was great, and to some degree it burned us the hell out, and we would 40 looking 55. Okay. And then you have your millennials and your Gen Zs who are just the opposite. They got the technology thing on wrap. They got this, they got that. They're like, no, you're gonna give me my vacation time, but they have no work ethic and or limited work ethic. And I think that sometimes we need to learn from them and they need to learn from us, from instead of being so confrontational. They don't feel like we have anything we can teach them, and we feel like, oh, they're just a waste of time. And I think that that's where the disconnect kind of comes in, right? So let's get back to the whole nursing doctor thing. So when it comes to nurses, and I'm gonna keep it 100 with you, the reality of the situation is a lot of the new nurses that come out, they come out wanting to do little to no work. They ain't finna change nobody's bedpan. They don't want to do that. They want to come straight out of school and be traveling nurses or be this or be that. They want the money. That's what they want. They want the money. Back in the 80s, let me make it clear to y'all. Back in the 80s, oh, doctors got rich. Now, baby, most of the executives, some of the nurses make more than a doctor. So don't think doctors out here just catching a check. We are not. That was some old 1980s stuff. Okay. That was when it was mostly white males. Okay. We are not catching a check like that anymore. But it's so, I don't really want to work. You ain't about to break my back like that. I'm not about to do all that. That's just too much. And we're not focused on the patient. And we're focused on everything but the patient. A lot of people did a lot of training in COVID. Do you know they continued to train nurses in COVID? Again, we had a shortage. Nurses were retiring. Nurses died, right? So what did they do? They were like, okay, we got to get some nurses. They literally virtually train nurses. How do you virtually train a nurse? How do you virtually learn how to put an IV in? How do you virtually learn how to put a catheter in? Okay, so a lot of people now, back in the day, back in my day, you could not come out of school and be a nurse on labor and delivery. You couldn't do it. It was a no-go. Labor and delivery is like critical care because you have two patients in one. So you had to work for some time on med surge. Then you had to apply for a job once one of them little old battle axes, honey, because they kept them jobs for 30, 40 years. Once some finally retired, then you could potentially try to apply, okay, and get in to labor and delivery. But it was not labor, honey, they taking them right out of school, child. They ain't even got their nursing license half the time, and they up on labor and delivery. Okay, so you have a training disconnect. Now, I'm going to tell you guys something that happened in the medical realm that is scary as hell. And I say to my patients, I'll be like, who's your primary care? How old is your primary care? And I hate to say it because if your doctor less than 45, child, the chances of them taking you out might be pretty high. Okay. Now, that's a joke, but it's serious. What do I mean by that? So in medicine, again, we used to have, and I'm not saying that this was right, but I'm not saying that this is right, but it's true. So in medicine, we used to work. Sometimes when we were on call and we were residents, we would do 130, 150 hours a week. Sometimes our weekend call was 36 straight hours. Like, it wasn't right, but it was what we did. It taught us endurance. It taught us how to work hard. It taught us when we delivered 5, 6, 7 babies, like now in our life, we still rolling. These young doctors be like, no, I need the backup to come in. I'm exhausted, baby. I got somebody 8 centimeters. I got an emergency C-section rolling and somebody on their way in because the baby ain't moving. I'm hustling. Okay. Now it's like, So what happened? So there was, I have to say, probably in 2002, 1 or 2, at the turn of the millennium, right? There was a resident and he was working. He did his 36-hour shift, right? And it was holiday. I want to say Thanksgiving, Christmas. It was snow on the ground. It was holiday. And instead of him going to the call room or going home and going to sleep, he gets on the road to go home. So, unfortunately, God rest his soul, he banged out, hit a tree. It was a wrap. So, when our loved ones die, when anybody, you all know how it is. And I'm not coming at anybody sideways. We kind of need somebody to blame, right? And so, his mama went hard at the AMA. All right. And what ended up happening was the AMA changed it and said, okay, no resident can work more than 80 hours a week. So essentially, what they did is cut the training by half. So when we talk about the residents and the younger doctors being trained by half, what does that mean? I tell people all the time, you can't learn how to do what I learned how to do in half the amount of time. Also, I want to say maybe about 3 years ago, I'm in the middle of a hysterectomy with the resident, taking a resident through a hysterectomy. She says to me, Dr. Rogers, I need to scrub out. Now, I could be a little bit of an asshole in the hospital because I know how hard I worked and I know how important it is. When something goes to the left, I'm not like, oh, the patient in room 6 expired. No, I'm thinking to myself, that family is going to miss this patient at the next holiday. They got to write an obituary. Like, she's never wearing her clothes again. Like, this is the kind of stuff. So I'm like super anal about stuff. So I'm like, what do you mean you need to scrub out? Do you got to pee? Like, what does that even mean? And she's like, no, I've completed my 80 hours for the week. So if you know me, I got a little bit of a pop-off gene, but I pulled it on back and I said, oh, you finished your 80 hours for the week. Okay, so that means that you're leaving, you're done for the week. So she goes, yes. I said, okay. I said, so when you leave, just out of curiosity, because they told me I was confrontational. I said, so when you leave, just out of curiosity, because I don't want to make you uncomfortable, because that's another thing. I don't want to make you uncomfortable. What are you going to do? She said, oh, I'm going to go to Starbucks and read about the case. So I said, so let me be sure I'm clear. You're standing here with your hands in a patient's belly and you're doing the case, but you're going to scrub out, go have a cup of coffee and read about the case that you're actually doing. Yeah. And there was nothing wrong with that with her. I said, be blessed. You're okay. Okay. Now, this is what I'm talking about. This is what I'm talking about. And at the end of the day, we have a lot of, now I'm not saying you don't have any young doctors who are good and don't have a strong work ethic. I'm not saying that, but what I've seen more times than not is what I just expressed to you. And so now let's forward to labor and delivery and everybody having complications. You have a nurse oftentimes, and even on the floor, right? You have a nurse who is not well trained enough to see when a patient is going down an aisle or going down a street of not doing good. Them old back in the day doctors, those nurses, they would call. They'd be like, Dr. Rogers, I'm gonna need you to come back here. I don't know. I mean, her bleeding is all right, but I don't know. Like, it just something ain't right. I need you to come back and lay your eyes on her. Lay hands on her, and I'll be like, I'm on it. Now, unfortunately, um, it's a situation of I can't be everywhere, right? And once I do my job, you're stable. I go on and I know when I'm coming back. I'm coming back the next morning. I'm gonna check on you, check your vitals, do to get you up, get you moving. Da, 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 da. But I only know there's a problem if somebody calls me and says, hey, something's wrong. The heart rate is not okay. She's bleeding a little heavy. I don't know. She's a little uncomfortable and it doesn't seem right. That's the only way I know. So if you have nurses who are not astute enough to be able to tell you when something, this is not all. So I don't need no nurses being like, we ain't like, no, some of y'all are. And I'm going to tell you, I'm going to give you an example. But if you have nurses who are not astute enough to know when that patient is starting to kind of tunnel downhill, or is not checking on the patient enough to know that things are not looking the way that they should look, then when they finally call, because the situation is finally kind of getting a little bit out of control, yeah, then you got the doctor who don't really know what to do about it because they're not really trained in critical stuff because they was at the Starbucks. I hate to say it. I'm making it sound funny, but real talk, that is the situation in which you find yourself in. Okay. Now, this technology stuff is all good. It's all gravy. It's all Gucci. But sometimes let me tell you what happens. So the younger doctors, I'll tell you in a minute, I don't do robotic surgery. Why don't I do robotic surgery? Because I wasn't trained in robotic surgery. I'm not about to go back, take a class, take a course. And no, that wasn't what I was trained in. Now I got a bunch of younger colleagues who I do trust. I'm going to send you over to them if you want robotic surgery because it's Gucci. I just don't do it. Laparoscopic surgery, absolutely. Open surgery all day and twice on Sunday. But robotic surgery, that ain't my jam. I'm woman enough to be able to admit that ain't my jam. And I'm going to send you to somebody who is. Okay? That's how it should be. Unfortunately, again, with the younger docs, and I'm not coming at the younger docs. This is not an attack on them. I'm keeping it 100 with you. With the younger docs, they were trained in robotics, trained in laparoscopy, but the whole goal is so we don't open people, right? Yes, but they were trained in that. So now when it comes time to actually open somebody, they don't know how. They're not good at it. So if you got a robotic case or a laparoscopic case and it goes to the left and now you have to open, oh, that's a whole different bowl of wax right there. So we're dealing with that as well. So let's be very clear. And a lot of what happens in medicine too is, those doctors from the 1980s, the ones that got rich and were, males and arrogant and all this kind of stuff, that left such an impression on nurses. They used to abuse the hell out of nurses. I'm not even going to front. That was a time when they could grab a nurse's tits, a nurse's butt. They could do whatever they wanted to do to these nurses. Okay. And there was no retribution for it. Baby, I don't know if that's in their DNA. Baby, they done carried that for decades. Okay. And they still got that angriness toward doctors. We ain't do it, sis. We in the same boat with you. We did not do it. So now you have a situation where you have health systems who are being run by nurses. So some hospitals, a lot of hospitals, if you take a look at this, the CEOs of those hospitals are nurses or business people. Very seldom are CEOs or people who are in charge in hospital systems. Very seldom are they actually physicians, right? So I'm going to keep it 100 with you and say, I cannot walk on a medical floor and know what a nurse needs that's going to make her feel valued, make her feel wanted, make her feel respected, and make her job easier because I don't know her job. I don't know her job, right? So I can't do that. Like they'll come in after we've been hit with like a slew of patients, and to reward the nurses bring pizza. Nobody need no damn pizza. They can buy their own damn pizza. They need some extra staff. They need to be able to sit down. They need an extra bathroom break. But if you don't understand their work or their job, then you don't understand how to help them. So now let's switch the screen to now you have nurses who are floating as CEOs, chief operating officers, this, that, and the third. And again, it is what it is. If you're doing a good job, kudos to you, 10 out of 10 recommend. But the problem is that you tend to want to better the system by what would make nursing better, not what would better things for a physician. Right? So now you have doctors who are disenfranchised. They're feeling like they're not being respected. They feel like a nurse will tell you in a hot minute, 2 nurses equals 1 doctor. Girl, what kind of ghetto ignorant math is that? And I say all the time, and I was like, that's fine. I don't really care what your math looks like. But when your mother comes into the emergency room, and if she's coding, we're going to put 2 nurses at the head of the bed instead of that doctor. How about that? How you feel, sugar? So, that is the disconnect that we have. And I just feel like, and I tell nurses all the time, no, you can't do my job, but I damn sure can't do yours either. And I don't want to. If everybody stays in their lane and they perfect their lane, we're going to win. But when this person want to do this, and this one is trying to get back at this one, these doctors think they all that, they're not going to do this and they're not going to do that. And it's like nurses are doing crazy stuff and they're not getting punished because other nurses are in charge. And it would just seem like the doctor wins if the nurse gets punished. Baby, ain't nobody, baby, who? So, this is a lot of the politics that you see. And people say, well, all nurses aren't like that. You're right. You're right. You're right. There are some nurses that I've worked with. Shout out to, I ain't even gonna call no names, but there are some nurses that I have worked with who are absolutely freaking amazing. You understand what I'm saying? These are nurses where I'm like, I'm going to sleep. Call me if you need me. And I can literally sleep, not worry about it, and know if I don't get a call, I'm not needed. That patient is stable. We're good. And the one nurse who made me actually stop practicing obstetrics, and I hate to have to say that is the situation, but it is. Because here's how I feel. You're not going to hold me responsible for a situation that you won't allow me to control. All right. So what happened was, I think they had probably called me like around 9 o'clock at night. And I'm so anal. I'll have my laptop open on my bed watching the baby strip from home. I can see the baby from home. I know when she's off the monitor. I know I'm looking, I'm like, I don't like the way this looks. Or she looking at this strip, she should be ready to push kind of soon. Right. So I can see all that, and I'm super anal about it. So the nurse had called me probably like around 9 or 10 o'clock and was like, oh, she's about 8 centimeters, Dr. Rogers. This is her first baby. So at 8 centimeters, it should probably take her 2.5 hours to get to 10 centimeters, right? And so at around midnight, I was like, I haven't gotten a call. So I'm not going to call you. I'm going to just get up and come and see for my own self what's happening, because that's how I roll. So I come to the floor. Now, before I find the nurse, because I need the whole story, I go to the patient's room because I want to know what's happening I want to know from the patient's perspective what's happening. So I go to the patient's room. Patient, I said, because we got an epidural, right? So while I said, hey, how you doing? What's going on? She's like, I don't know. It just hurts. I'm waiting for anesthesia. You waiting for anesthesia? How long you been waiting for anesthesia? About 20 minutes. 20 minutes, because anesthesia's office is right down the hallway. So what we got going on? I just came from outside. The place is not on fire. There are times where you're going to wait because the place is on fire. So to fix somebody's epidural versus to get a baby to the operating room and save their life, baby, you low on the list. But if none of that is happening, why we've been waiting 20 minutes for anesthesia? I don't know. It's just the pain. I said, the pain. I said, okay. When's the last time the nurse went in here? Oh, I don't know, about 20, 25 minutes ago. Okay. So the patient in pain like this, you ain't at her bedside. What we got going on? So I put my glove on, pull the covers back, see the baby's hair. So she's crowning, like the baby's head is right at the opening of the vagina. I said, oh, okay. I said, we're about to have a baby. I said, let me go and get dressed. I said, everybody, let me go get dressed. So the family's all hype, okay. So I go into the break room. The nurse is braiding another nurse's hair. I said, who is whatever the child's name was? Oh, that's me, Dr. Rogers. How you doing? I'm good. I said, oh, okay. Well, you got the patient in room 6? Yeah, I got a patient in room. Yeah, I don't know. She's like still 8 centimeters. I checked about 10 minutes ago and she was still 8 centimeters. Yeah, I called anesthesia because she's a little uncomfortable, but I ain't seen him yet. Did you call him again? No, I called him about 5 minutes ago. Oh, okay. I just left room 6. She's complete and +2, ready to push. I'm going to set it for oh, no, I'm going to come. No. Don't come. I don't need you. I'll have the charge nurse come in. You continue to braid hair. and I'm going to go and deal with the patient who's actually in labor and delivery. You know the name of the unit. Don't come. So again, I'm in a break room. I'm in a quiet place. I ain't yell at her. I ain't cuss at her. I ain't nothing. The next morning before noon, I get the call from the chief medical officer, like, we need to talk, Dr. Rogers, because, you were very confrontational with the nurse and she's very uncomfortable. She's been crying and doesn't want to come back to work. So what? First of all, and so then the West Philly, my eyebrows, my brows started to furrow, and I was like, "What?" So went through the whole thing, and I was like, "Listen, I'm in surgery right now." I was like, "But I'm gonna call you back." But what I want you to think about, because I hate to say it, and it's part of my problem, because I'm just not scared. I'm just not. You want me to leave? I'll leave. That's fine. I'm gonna eat anyway. I'm not a skinny girl. I was eating before I met you. I'm gonna eat after that. So I was pissed, and I said, "But I want you to think about, while you waiting for me to call you back, if that was your daughter who was in that room, who I advocated for, would we be having the same conversation? And I'll call you back when I'm done in the OR with somebody else's mother. How about that?" And so when I literally, and when I called him back, it was very much a, "You can't do that." "I can't do what?" And I was just like, "You know what? I'm not doing this, because they're going to kill somebody. They're going to freaking kill somebody. And then they're going to look at me like, 'Well, where was you at, Dr. Rogers?' The family's going to look at me like, 'How did you let this happen?' And again, I can't be in a place if I don't know. I can't just sit in the hospital for 24, 28, 38 straight hours waiting for you to have your baby. No, I got a bunch of stuff I need to do, but that's why I depend on nurses to clinically tell me where we are so I can make decisions on what needs to be done. Does that make sense? And once I realized that that's not the environment we're in a situation where it's nurse versus doctor. And if I don't let you get away with murder, then I'm the problem. And when the baby dies, expires, comes out with cerebral palsy, has an anoxic brain injury, anything, I'm the problem. But if I say, "Hey, listen, let me talk to you in private and to the side," and you start crying, I'm abusive and I'm the problem. So I said, this is not an environment for me. And this is why I don't deliver anymore. But when I was delivering, guys, and all this is to say, to God be the glory. Okay. This is none me. Some of it was me. But for the most part, 7,000 deliveries and no fatalities, because I'm anal as hell. Okay. But let's talk about that, because I want to walk you guys through this. I want to walk, if you are a black or brown woman, if you know a black or brown woman, if you love a black or brown woman, this right here is the live for you. Okay. I want to talk about us starting to take care of ourselves in this political climate that we're in, baby. We have to be astute and we have to know if somebody does some stuff to you, who you going to? You going to the EEOC? No, that doesn't exist anymore. Who you going to? Okay, exactly. So I need you guys to literally understand the importance of, especially right now. I don't know if it's going to be like, maybe it'll get better, but especially right now, you have to understand the importance of knowing how to keep yourself as healthy as possible, knowing who to go to, knowing what to do. Okay. It is extremely important. If I can't get anything else across to you guys. Now, I want to talk about some life stuff that, and you don't gotta get a pen. You don't gotta get a pen. I'm gonna tell you why you don't gotta get a pen in a minute. I'm so excited. Um, I I would give other providers certain, key points, key tips. My patients, they know, baby, they know from GYN to trying to get pregnant to OB. They know the rules, and I don't play with the rules. And you play with the rules, I will gently escort you out of the practice. You need to go over there. Will they allow the foolishness? I don't allow the foolishness. Why? Because I'm not dealing with no nonsense when it comes to your baby. And I have to say, if I had to say, and if any of my people on here, they can co-sign me right now, I would have to say 7 out of 10, maybe even 8 out of 10 of the children that I deliver are mentally gifted. One kid is in Mensa, one kid is like 3 and speaks 3 languages. Now I don't know if it's because of what I did, but I do want to take credit for it, though. I do, but I don't know. But I'm just saying, I want to talk to you guys seriously about as a Black and brown woman. There's a couple of things that you need to be doing on the everyday basis. Okay, um, and I'm serious about it. One thing you guys need to be doing, and I know it sounds like a broken record, but it's so damn important. Please pay attention to what you put into your body. Please pay attention to what you put into your body. We got to stop. You know, the one thing I love about us. Okay, and let me say this. The one thing, they say 1 out of 11 physicians unalive themselves. Like, and I don't know if that's like a day, a year. I don't even know. It ain't my. I don't even think like that, because in the space when we have a bad day as Black women, what do? We call one of the other. We usually will call another physician, because they're going to understand the space that you're in, right? And so what we generally will do is we'll call them and we'll be like, girl, today was a day. And that's why a lot of us are overweight, because what do we then do? It's like, girl, I'm done. Meet me at such and such. And I don't care what restaurant it is. We're gonna canoodle. And this is what we do as Black women. And we gotta change this. We will get together to comfort each other, canoodle each other, have conversation over a drink, some appetizers, maybe even a meal. And baby, if you ain't got room for nothing else, you're gonna stop eating so we can get that dessert down. Okay. And a lot of us are guilty of it. My friend Dr. April Spencer, breast surgeon, she said to me, every time you open your mouth and put something in your mouth, you're either fighting disease or feeding disease. Now, she got me with that one. She got me with that one because she was taping my podcast, right? And I don't know, I think we had wings. I don't know what we had, but I had like kind of like dropped it, like mic drop. I, I felt you, and I feel indicted, sis, but I felt you. And we have to be in that space. We need to be like, girl, I need to talk. You want to go for a walk? Like, come on, let's get out of here. Let's just go for a walk. And it's important. We got to stop putting all this inflammatory food in our body, all this processed food. The cheapest stuff is the most dangerous stuff. Okay, the pastas, the rice, the bread, the potato. It's cheap, it's comforting, and it's good, but it's terrible. Why are we walking around in chronic pain? Oh, my hip. Why is your hip hurting? You are 37. Why? What's wrong with your hip? What is happening? Your joints, all that creates inflammation in your body. Okay. And it sometimes can present as chronic pain. We don't even realize that as Black women, the burdens that we carry, our depression even comes across as chronic pain for us. Abdominal pain, my shoulder hurts, my arm hurts, my neck hurts. Sometimes a lot of the depression and the anger and the things that we carry, because we just have a unique space in this world, it comes across as pain. It's pain, and then they can't find anything, so then they call it fibromyalgia. And I'm not saying fibromyalgia does not exist. I'm saying a lot of times, if they cannot pinpoint the actual reason for your pain, they'll call it neuropathy or fibromyalgia, and now you're on medicine, right? And it's okay to be on medicine if you have conditions, but it's like, come on, we gotta pull back. We have to start drinking our water. I don't know what it is with Black women and water. It's like our kryptonite. We ain't with it. We want some sweet tea. We want a Coca-Cola. We the water is not, and you're like, oh, my skin looks bad because you ain't drinking no water. That's sugar. Drink some water. Water, I say water is nature's elixir. Like, it literally can help fight disease. Water is that girl. We need to start. I'm not saying that all of us need to become like, raw vegans. I'm not saying that, but cook. Stop eating this processed food. Can I share something with y'all? Whether you eat at Applebee's or whether you eat at Capitol Grill or Roost Chris, all the food comes from the same place. And it's like US Foods or Cisco, where it all comes from the same place. It's all processed. It is all processed. Let me be very clear. Now, they got different chefs, they got different dishes, they got different sauces. So they got it coming out there looking like that girl. Like, literally, the cow is in the back waiting to get unlocked. No, that is all processed, very much processed. Okay, so let's be intentional and mindful. I don't have time for that. Why don't you? You don't have time for you, but you got time for him. You got time for these kids. You got time for that job. You got time for the pastor. You got time to be in everybody business on the deaconess board and on whatever woman's ministry you on. But you don't have time to say, okay, let me go to the grocery store. Let me put some salmon in the oven. Let me get me one of them already made rotisserie chicken, but spray them down and cook them some more because they don't be done enough. Some rotisserie chicken. Let me make a salmon. Let me make some not the spaghetti per se, but let me make some pasta. What do you call it? Ground meat and put it in a pepper or whatever. Let me make some tuna for the week. Something. I will do a salad. The way I do my salad, of course, you can't keep a salad for a week. I keep the ingredients separate. Chop up some tomatoes, chop up some cucumbers, chop up some onions, boil some eggs, chop up some peppers. I keep everything separate so I can always have a fresh salad. Boop. Just saying.
It's expensive.
Yeah. Okay. So I want to disagree with you on the expensive part, sis. It depends on where you go. Why are we not going to the farmer's market? Because one is going to be fresher. Aldi actually is found to have fresher foods than Trader Joe's. Because baby, I love me some Trader Joe, but they have recalls like a mofo. Every time I eat something, I be like, Lord, I hope this ain't got no glass in it. I love Trader Joe's, but they got recalls like crazy. You understand? Go to your local farmers market. Here in Atlanta, at the Cab Farmers Market. There's one on the south side of Atlanta. I don't know the name of. You know the name of that one, Justina? I don't know. But it's all the way like in Riverdale. Forest Park. It's Forest Park Farmers Market. You have one. Um, and then you have the local people. A lot of times they'll do it like one day a week at like a church parking lot or something. Those are local growers. Baby, they a little bit more expensive. But if you go to the farmers market, baby, the vegetables cost the same at Walmart as they do, and they might be even more expensive at Walmart. Okay, you can go farmers market also has meats. Okay, again, Aldi is a cheaper version, and I don't know why y'all look at Aldi as the low because y'all know all y'all bougie people who think about going to Whole Foods, you know all that organic stuff at Whole Foods. They just did an expose, baby, and that stuff is from China. I'm just saying, it ain't me. It's on news. You can look it up, do your own research. That's what I'm saying. So there is a way to definitely eat well. And it doesn't have to be expensive. It really doesn't. And the more food you make at a time, the better. Like, that's why I say make 3 meals. Because one of my patients was like, we were talking about meal prepping. And I said, well, tell me what meal prepping means to you. And then she was like, well, I'm going to make this. And so she was talking about the meal she was going to make for the whole week. Girl, who want to eat the same thing all week? No wonder you jumping off and going into drive-throughs and all that. No, ma'am. At least make a couple of different meals. And then if you boil some eggs, and then go ahead and I don't like to dirty up my stove. So if I do bacon or something, baby, she got to go in the oven. It comes out crispy. I mean, so at the end of the day, you can do these things. What day do you have off? Sunday? It's going to take you 3 hours to make about 4 meals, 5 meals that you can eat off of all week. You're going to save yourself some money. You save yourself some inflammation. You know what's in your food, because why are we getting all this E. coli and Hep A and Hep E? Because people don't wash their hands when they make your food. You don't know what them people got. You don't know. No. So that's one of the things that we have to be mindful of. Also, obesity. Now, let me be clear and say this, okay? I'm not a skinny girl. I'm not skinny. Because I know what to do don't mean I do it. But here we listen, we don't judge. So the point is that obesity is a disease. And unfortunately, obesity makes everything more complicated. It makes it more complicated for you to get pregnant. It makes it more complicated for her to have an uncomplicated pregnancy. It makes delivery more complicated. And let me tell you, when y'all come in and it's C-section time. Let's say for whatever reason, either scheduled C-section or it turns into a C-section. When you have poor nutrition, I can tell when I do your C-section. How? This is how you can tell that the inflammation affects every body part. When I throw a stitch and I go through your uterus and I throw a stitch, when you have good nutrition, that stitch will hold. And then I throw a next stitch and it'll hold. When you have poor nutrition, I throw a stitch and it pulls right through. So now you're bleeding in 3 places instead of 1. That's when we start to get into foolishness. Then again, I said, hopefully you in the operating room with somebody who knows how to get control of that situation. Okay, so we always know. And that's why sometimes I have had patients on the table and be like, I'm gonna get you because what you told me was that we was eating right. But based on what I'm saying, you've been in American Deli. You've been in American Deli. And I make it fun and I make it funny, but I'm serious. And they start laughing. They be like, Dr. Roger, you so crazy. But at the same time, I know what I see. And I'm trying to tell you how to stay out of problems, because if you think you're going to run into somebody in that hospital, 9 times out of 10, they can get you out of trouble. Mm-mm. So the goal is to stay out of trouble. Okay. So it is watching your weight. We in our community, we ain't finna lose no man if we 300 pounds. It just ain't going to happen. So we a lot of times don't necessarily see, or woman, no judgment, I don't care. But whoever your partner is, in our community, they ain't fitting to walk out because you overweight. Okay. But that's problematic, because a lot of times if the people who love us don't find a problem with what we look like and what we doing, we don't necessarily find a problem, right? But when people like 250, 275, and they're like, I'm thick. No, the girl who is 175 is thick. You ain't thick, sugar. No, ma'am, you ain't thick. You ain't thick. Okay. So we got to get away from that, and we have to start accepting. I don't care what size you are. I want you to be the best version of yourself. And that is your health. It does not matter what you look like. It does not matter what size you wear. It matters that you are the absolute best version of yourself. Okay. Think about this. And I want everybody to think about their own weight. Let me drop some tea. For every 1 pound you weigh, 4 pounds is on each knee. So if you're 200 pounds, 800 pounds is on each knee. That means 1,600 pounds is on your hips. You know how much a car weighs? 2,000 pounds. So every day you're asking your hip to damn near, and one of them Priuses, them little ones, they probably weigh 1,600 pounds. But you know what I'm saying? You're asking your hips to damn near carry a whole car every day. So what's up? Oh, I saw that. So we're going to get to that. So at the end of the day, we have to start taking more into account, not just about our weight because of what we're going to wear to Tulum, or what we're going to wear to Mardi Gras, or what we're going to wear to NBA weekend. It's NBA week, one of the weekends. Y'all know how y'all do. No, it's not about that. Okay, it's about the level of inflammation in your body. That inflammation starts to attack your organs. That is when we start to get stuff like high blood pressure. Y'all walking around with cankles. I saw a girl in my office the other day. She was 16. She had cankles. Why you got cankles at 16? That tells me, and I spoke to my cardiologist about it because I'm like, you need to go see the cardiologist. I don't like this. So the cardiologist actually told me, with her having swollen legs like that, swollen calves, it is congestive heart failure until proven otherwise. And a 16-year-old who plays basketball. Literally, I was smelling myself and feeling myself because I was like, damn, I hope I just saved this girl's life and she not about to fall out on the basketball court with cardiac arrest and nobody even knew. And I said to her, mama, you didn't see her? She's like, I'll be looking at her legs. Girl. And I guess who would? But at the end of the day, I would notice, because when she came in the office and I'm sitting there talking to her and I'm looking at her like, why does this girl have cankles? And I'm like, how am I going to introduce that conversation? But I did. So the point is that we have to be very focused on what we're putting in our body. And the logic behind that is, we all know we all don't drive luxury cars, and that's fine. But think about the logic. If you don't know, if you have a Mercedes Benz, you can't put 87 in her. You can't put 87 in her, girls. You can't. If you have a Mercedes and you put 87 in her, you're going to get about a mile or two before she starts choking and pulling on you. And she might not even break down, but you just insulted her engine. You insulted the car. You done ran that cheap gas through the car, and the car is letting you know it. Okay? So with that being said, your body's the same way. You put crappy food in, you got all this fast food, you got all this processed food. You might not break down immediately, but you're choking. You're choking. All right? So we got to pay attention to that. Let's have some water. Let us pay attention to what we are putting in our mouth and stop, because you're going to have a moment where you want some French fries. I'm not saying that. Come on now. But let's not constantly feed disease. Let's fight it sometimes. All right. And let's not be obsessed about how we look with relative to our partner, or how we look in some clothes, or how we look on vacation. You know what I mean? Like, think about them 4 pounds on that knee. That's what I want you to think about. Them 4 pounds on that knee. Now, whenever somebody asks me the best way to lose weight, it is going to vary. Weight loss and this is not about weight loss. We just happen to veer down here because it's such a big topic for Black women. Weight loss is not the same for everybody. And this is why some people fail and some people win. The way you lose weight is based on your metabolism, not your blood type, not all this other weird stuff they got going on, not all this gimmicks. The way you lose weight is based on your blood type. I mean, based on your metabolism. Your metabolism is determined by your BMI and your abdominal circumference. Okay. So you literally need somebody who understands what the hell they're doing, not just peddling pills and shots. You need somebody who understands what they're doing and say, hey, listen, this based on your BMI, this is your metabolism. Based on this metabolism, this is what you're going to have to do to lose weight. Because if you have a particular metabolism, if you go in that gym and lift weights, you're going to gain weight. You're going to gain weight based on certain metabolisms. Okay. So these are things literally that you guys need to be like, and I'm glad you're inquiring about them. We need to be on these things with respect to each other and saying, hey, sis, you look amazing. You look amazing, sis. Like, do you go to the gym? What do you eat? Like, and it may not, what works for her may not work for you. But we can't get defensive. Just because I'm overweight don't mean I'm unhealthy. Ain't nobody say that. Ain't nobody say that, because it doesn't. But them damn knees is unhealthy. Okay. Because that 300 with 4 pounds, that's 1,200 on each knee. Okay. And which is 2,400 on the hips. So you got a little sedan with a little hatchback that you carrying around every day on those hips. And I'm not judging you, sis, but eventually a knee replacement and a hip replacement is coming. Why is it that it seems like every time we see a Black woman who's 55, 60 years old, she waddling from side to side like a penguin? And then she got to get a knee replacement and all the things. Okay. So, and you're right, semaglutide is not for everybody. And neither is tirzepatide. The shot is not for everybody. Again, depending on your metabolism, you will not lose weight with the shot, but you may lose weight with medications. So it really just does depend. So it is not a one size catch all. It is I want to get healthy. I want to get healthy. I want, my pressures to come down. I want my blood sugars to come down. I don't want to be pre-diabetic. I don't want all this stress and heaviness on my knees. And it is literally worth going to see a healthcare provider who knows what the hell they're doing to help you through the process and the journey. We got to see this as important. Also, my young ladies who are going out partying, I want you to have a good time. I want you to have a great time. We all did it. Not me so much. I was damn studying. I missed it, but I'm going to catch it in my 50s. Okay. Anyway, I'm going to spin the block on the club. Okay. But anyway, the point is that, please be very careful with hookah. Now, I don't really understand it myself, because it's not like when you in Dubai and it's hashish and it ain't all that. Okay. You're just blowing smoke in and blowing it out. And I guess you think it looks cool. Again, we listen, we don't judge. But what I can tell you is that when you hookah, it decreases your fertility. So if you are a young lady and you're looking at getting pregnant, you're looking at being pregnant, you're wanting to be pregnant sometime soon, hookah should not be in what you're doing when you go to the club. Okay. Also, I want to let you guys know this as well. Tongue pop. Another thing that is big. And I probably was about 2 months ago, years old, when I learned this. I mean, we always knew that alcohol wasn't great for you. It worsens your depression. It creates weight gain. We all knew that, right? It makes you feel good while you're doing it. But after that baby, it magnifies that depression, and the next morning you crying. And, they used to say, bite the dog that bit you. So you wake up feeling bad, you drink some more liquor so that you feel good again. And that's how we get into bad places. But again, I was 2 months ago years old when I found out that alcohol, and I don't know who knows this, but alcohol is the number 3 cause of cancer. Did you guys know that? So for all of my people who are like, oh no, I don't do this because it causes cancer, all this causes cancer, all the things cause cancer. And they do. But alcohol is right up there with number 3. And I don't care how many glasses of red wine, how expensive the red wine is. If got alcohol in it, come on over here with us, sis. Come on over here with us. And when I say us, I say me, who will have, yes, I'm a weight loss specialist. I say me, who is going to have a French fry every now and again. I say, my homegirl who's gonna have a margarita every now and again. I say, Pookie who gonna heat up the Fabuloso on the stove. No judgment, but everybody's kind of in the same, and we're trying to figure it out. And as I say, put together a routine that is going to be good for you and do as best as you can. Nobody's judging you. Nobody can completely live chemical free, especially not in this environment we're in, but we can do the absolute best that we can to be mindful about what we put in our bodies. Okay. So that is one of the biggest things. Now let's get back to this whole hospital thing. So guys, one thing that I can say, when we're trying to get pregnant, our nutrition is very important. Another thing I'll tell you guys, about 6 months to a year before you're looking to get pregnant, um, prenatal vitamins. Prenatal vitamins, 6 months to a year. And no, people always think prenatal vitamins make it easier for them to get pregnant. Girl, child, please. I can't scam people. But if I could, I'd be marketing a prenatal vitamin to increase fertility. And it'll be a lie, but I would be doing it. Okay, so but you need that. You need the folic acid. You need the DHA. You need all of those things that are going to help, because by the time you actually find out you're pregnant, the fetal spine is already developed. So if your baby's going to have spina bifida due to not enough or deficiency of folic acid, it's already done. It's already done. So please, in preparation, you can't just, I want to get pregnant. I want to get pregnant. Um, there's preparation. So let's get this body together. Let's get these vitamins and all this on board. And it is very, very, very important. And let me tell you about your baby daddy. Because I know a lot of y'all don't like to touch this. People get touched. We can talk about these baby daddies. But let me tell you about your baby daddy, because I think that it was something that, again, was never touched. All he had to do was really get you pregnant, right? No. Did you know there is a 50%? Now, I'm going to say this slow. There is a 50% increased risk of your baby having autism if your baby daddy is overweight. Yes, ma'am. Yes, ma'am. Yes, ma'am, it is. So it is to your benefit to be like, it ain't just me getting pregnant. Come on, we are getting pregnant. Let's go for this walk. We are going to eat better. We are going to take vitamins, because it plays into the well-being. Now, thank God I decided not to have kids, because the girl, all of her 20s and 30s, was a chubby chaser. I used to like cute fat boys. I did. I don't know why. They spoil you more. I don't know what it is. At least they did back in the day. I don't know what y'all got going on now. But I'm talking about back in the day, like Heavy D. I'm talking, I was I like me a little good hair now and again. I was into the cute fat boys. But and I'm glad that I decided, because honey, it probably would have been somebody fat. That was a derogatory term. It would have been somebody overweight. Okay. But I'm just telling y'all what I liked. All right. So, but it's important. Now we know better, we do better. Okay. So it is very important, not just to be on yourself and be like, because y'all will come to the doctor in a minute. Why can't I get pregnant? As if it's a one-sided thing. Well, no, let's look at everybody. Let's look at everything. Well, do this test and do that test. And do this test. Well, we need to do a semen analysis on him. Wait a minute. He ain't gonna agree. He ain't gonna agree to that. Okay, well, you want me to solve an algebra problem, and you giving me the X, you ain't giving me the Y. Well, what I'm supposed to do? That's too many variables, sis, if you remember back to school. So those are the things that I want you guys to bear in mind now. When we finally get pregnant, we finally pregnant. Couple of things and don't be freaked out about, before we even get to the pregnancy part, y'all. Don't be freaked out about, oh, you're going to write this down, or you're going to save this, or y'all ready for this announcement before we even delve into the pregnancy part? Oh, Justina, my heart is beating. Y'all ready for this announcement? First of all, this has come to pass for years and years and years and years and years. Again, my patients, who were my patients, they got a little bit of this. They would get this as we went. They would get one first trimester, they would get one second trimester, and they would get one third trimester. But I put it all together. And I have written a survival guide for Black women. The actual title is, and this is it, y'all. Yes, I'm so excited. It is entitled A Black Woman's Guide to Surviving Pregnancy, Labor, and Delivery. Bam. Can you see it? Can you see it? Can you see it? Can you see it? Yes. Okay. So I'm super excited about it. Okay. Everything I'm basically talking about is in this book. Everything is in this book. I mean, so even, okay, so we're pregnant, right? This book is going to tell you what tests you need to have. Every trimester is going to tell you what tests you need to have. It's going to tell you what questions you need to ask your doctor. It is going to tell you what you should be doing, what you should be knowing, what you should be eating. It tells you foods to avoid. It tells you what foods to eat. It tells you how to work out. I mean, I don't think there's anything not in here. It tells you what medications to take, what medications to avoid, what vaccinations are okay. It tells you about, the gender stuff, not gender, because that makes me mad. Okay, the genetics is what we're concerned about, and it should just happens to tell you the gender. But don't get all wrapped up in the gender, because that just annoys me. Because at the end of the day, talk to a parent who's had a sick child, and they would take a healthy child, no matter the gender, over a sick child any day. So don't get so wrapped up in the damn gender. Okay, now get wrapped up in the genetics and how healthy this kid is, and we could deal with the gender later. They got cute clothes in each sex. Okay, so I take you through first trimester and what to eat, what to avoid, because there's some things you can eat in the third trimester. There's some teas you can drink in the third trimester. You can't have it in the first trimester. Okay, some things to definitely have you avoid. Some of these myths that you got to stay away from. Y'all better start staying away from that damn castor oil in that third trimester. Stop it, stop it. But I will tell you what to do. So it is so much information in this book. It is literally driving you down the aisle. You need to ask your doctor this. You need to, it breaks down. Oh, I don't know how to do that. I don't know how to pin comments and stuff, baby. I don't know how to do that. Hold what down? The comment. Which one? Hold on, y'all. When is the book being released? Tonight. It is up tonight. That's why I decided to do the live. So, the book is released tonight, and it's on drtasharogers.com. It's on my website. The link you just, I don't see it, sugar. Oh, I might be far behind. I don't know. But anyway, that's just too much. You're going to have to do it, Justina. Justina's going to pin some comments or some mess. But anyway, so when I tell y'all it is everything, like, I mean, the food, the questions you're supposed to ask, I'm breaking down preeclampsia. I'm breaking down gestational diabetes. I'm breaking down gestational hypertension, which is a little bit different. I'm breaking down HELP syndrome, baby. I'm telling you how to figure out whether your baby is okay. I'm teaching you how to do fetal kick counts. I'm teaching you what to eat. I'm teaching you to go to labor and delivery. I'm teaching you all that. Okay. Now, the most important thing that I'm also hitting y'all with is this. Okay. And this is the part. This is the part where, and I'm not asking anybody white to close your ears. I'm just asking all the black and brown people to open your ears. Okay. When you get to labor and delivery, I'm breaking that down on exactly what to do and what not to do. You hear me? What does that mean? That means, first of all, I tell anybody, by the time you, and you're going to find this in the book, by the time you order the survival guide, by the time you get to 28 weeks, anytime you leave town, you're going on a long weekend, you're going 2 counties over to see a cousin, it does not matter. Whenever you're doing something like that, make sure you always have a paper copy of your chart. If you catch a pain and got to run into some random labor and delivery, they're going to look at you sideways. They're going to look at you like you looking for something. They're going to look at you like you scamming. When you 29, 30 weeks, you pop up, you got pain and you don't have any information. Always when you are 28, 30 weeks, when you're 28, 30 weeks, say to your doctor, can I have a paper copy of my chart? And every time you go, can I have this note? Can I have the, so you can make sure all your labs, if you don't have nothing else, if you don't have no notes, you don't have nothing, have your labs, especially if you travel somewhere. Again, that's in the book. Okay. So now we pop up on labor and delivery, either ours or somebody else's. If it's some, and I even tell you, keep a paper copy if you pop up on your own labor and delivery, like where your doctor, is going to deliver your baby. Why? Because computers do what computers do. And sometimes the computer may be down. Usually it's a computer that links the chart from your office into the chart from the hospital, into the hospital chart. But what if it's down? What if something's going on? What if they need your result? They need to know whether you're herpes positive or negative. They need to know what your group B strep status is. They need to know all that stuff. And what if the computers are down? You want to pop up and be like, bam, here's a paper copy of my chart, and never give it to anybody other than your nurse. You give it to the front desk person, baby, you ain't gonna never see that again. Okay. So all of that is in the manual and how to handle that. Now I'm gonna just give y'all a couple quick things to do. Okay. Again, all of it is in the manual. Have 2 support people. All right. First of all, it need to be people who know how to act. Okay. Don't get Pookeisha and say, oh, she like to fight. So Pookeisha don't need to be in there. Okay. So you need to have a 7A to 7P, just like the nurse's shift. You need to have a 7P to 7A. It needs to be somebody who's always kind of focused and watching and seeing what's going on. Okay. Then outside of those 2 support people, obviously it might be your baby, your partner, whoever your partner happens to be, and it may not be. Never have more than 3 people at a time. And the reason for that is if there's an emergency that happens with you, we got to be able to get into the room. We got to be able to get into the room because I'm telling you, I come in like a freight train. I'm stepping on kids. I'm stepping on sisters. I'm stepping on grandmothers, on walkers. Okay. She better be able to bounce back and rebound on that walker, because if she's in my way, I'm stepping on her. Because what I'm going to do is I'm going to get that kid out, be it in that room, or I'm going to get you to labor. I'm going to get you to the operating room. But anybody that stands between me and having a successful kid, it's a wrap. Okay. So I always tell people, don't have more than 3 people in the room at a time. Okay. Because it just crowds the area. We know you want love and all that kind of stuff. Let's get you settled in. Let's get you there. And then we can transfer people back and forth in and out. Okay. That's one thing. Now, as far as people who come with you is concerned, y'all, if I haven't said anything today that y'all are going to hear, can y'all please hear this? Whoever it is that's in the group that smells like weed, leave them at the house. Leave them at the house. If they car smell like weed, take a Lyft or an Uber. Don't come in their car. Okay. I'm going to tell you why. I don't know why smokers think that we can't smell you. We can. You can't smell your damn self, but we can smell it. And unfortunately, be it right, be it wrong, be it judgment, I don't care. You're judged when you walk in and somebody smells like weed. The people are disheveled. They look all crazy. They smell all crazy. You're judged based on that. And the notes are taken immediately. And what it says is that they're going to put a bag on your baby to test your baby's urine. And if there's weed in this baby's urine, depending on where you deliver. Now, if it's Atlanta, everybody damn baby got weed in the baby. Listen, defects don't even come to the damn hospital no more. They just be like, well, listen, tell the people not to smoke weed. They don't even come to the damn hospital. It's not it's a defects. It's defects here. It's DHS in Philly, but it's defects here. They don't even come. It's so many people. But if you're in the middle of Nebraska somewhere, and that's what you're doing, oh baby, the people come and they're gonna try to, put all kinds of restrictions and give you all types of cases, and you don't want that. Okay. And again, it really does determine how people treat you. I hate to say it, but it determines how people treat you. You got somebody, yeah, what y'all saying, so what we doing here is what, yeah, baby, boom, already right there you have been characterized. Lead them at the house, call them, FaceTime them. They don't need to be one of the 3. I'm not saying you got to have the proper well-spoken person, but people need to be acting like they got some sense. Just saying. Okay. And so let's fast forward, and because I put all the facts and details, because this thing is like this. This thing is about 50 pages, and I got a place in the back for notes and everything. Okay. Now, when you get to labor and delivery, let's say everything's going great. Everything is going great. Okay, wonderful. Let's say it's not. Let's say we run up on a complication, or we run up on something where we feel like, this requires some attention. This needs some attention. They're not hearing me. They're not listening to me. The first thing you want to do is please stay calm. I know when it's our family, we love our family, and y'all know it's Black and brown people, we get emotional, and we not arguing with you. We not yelling at you. We yelling about the situation. I know. Okay, I'm as brown as any of the rest of you. But do not lose the message because of the messenger. Okay, because you could be dead right, but when you come across like everybody's like, oh, she's ghetto and she's confrontational. And the one thing they want to do is kick you out. And if they kick you out, you ain't coming back. So you can't advocate for your person. You can't help your person. You can't be there for your person. You get what I'm saying? You can't. So if you want to be able to help that person, chill out. And that's when you got to put your Poindexter on. And that's when you go to the survival guide because I walks you through what to do. Okay. So the first thing you want to do, talk to your nurse and be like, hey, listen, this, that, and the third, you're doing the very best you can. I know you're busy. I know you're tired. But I have a concern. Can we talk about that concern? If you don't feel like you got what you needed from the nurse, then you say, okay, great, wonderful. I hear you, but I still have a couple of questions. The next person is the charge nurse. Can we talk to the charge nurse? Okay. Again, when you're talking to the charge nurse, make sure you're getting names, but don't be like, so what's your name? You don't need to do that. Be like, hi, I'm such and such. I am this to her. Who am I speaking with right now? Like, what's your name? And what do you do here? Okay, perfect. Now, let's always be as nice as you. Kill them with kindness because you don't want them to be like, yeah, she nasty. Because the next person who come, they going to talk to the last person. They all together. They in a group. They gonna ride together and they're gonna talk. So when that person comes in, they already have in their mind what they're gonna say to you, how they're gonna treat you, how they're gonna deal with you, and that's fine. That's fine. So now it's like, okay, the charge nurse, I don't really like what you had. Okay, cool, great. All right. Well, again, I know you're doing your best. You have a lot of patients on the floor. I just have some concerns. Is there somebody else I can speak with? Is there usually at night is going to be nursing supervisor, in the daytime too, is going to be nursing supervisor. That person kind of supervises the whole hospital. They're not as much invested. The charge nurse and the regular nurse is like this, point blank, period. If the nurse did it wrong, it's the charge nurse's fault. So she ain't gonna never really find fault with nothing the nurse is doing for the most part. Okay, not so never, but for the most part. The nursing supervisor, she's supervising the whole floor. And people only come on labor and delivery that have to be on labor and delivery. So she don't know what the hell going on. She like, okay, now what's going on? What happened? She said what the problem is. She's not really helping you because she can't. She understands the rules of the hospital, but again, to me, she's just a technicality. Um, Doing what you do. The next person would. It depends on the time of day. So you have chief nursing officer, which is likely never going to come and have a conversation with you. And then you have the risk management. Now, let me talk to you guys at this point, because by the time you get to house supervisor, nursing supervisor, whatever you want to call it, at this point, you personally should be calling your own doctor. Don't say to the nurse, can you call my doctor? Why she got to call your doctor? You call your doctor. The same way you would call them if you were at home and be like, I'm in labor, you call that same line. And you say, hi, my name is such and such. I'm in room 6, 5, whatever it is, on labor and delivery. Dr. such and such is my doctor. You're the covering doctor, because a lot of times it's going to be groups. So it is whoever is covering. And say, are you the covering physician this evening? Yes, I am. What's your name? Again, make sure you know everybody's name. Okay. Now, once you talk to your doctor, because they're not exempt either, because they're your doctor. That is who's responsible for you while you're there. And you've gotten up as far as house supervisor. This is where this book is worth its weight in gold. Okay. At this point, and I'm going to speed all the way back to first trimester, when y'all are paying for the pregnancy photos, them $25,000 gender reveals that don't nobody ever want to go to because they just be ridiculous. Whatever other kind of party or cookout y'all decide y'all want to have just because. What I'm going to recommend that every person that is going to go into the hospital, what I'm going to recommend you do is have an attorney on retainer. Now, let me, like y'all say, pin the comment, okay? Because that does not mean, and normally, and I'm trying to find a firm that I trust here in Atlanta that does that. I have a bunch of attorneys, but it's a special genre that I'm trying to have them create. to say, hey, listen, when these women get pregnant, it's like I guess, a maternity retainer. When they get pregnant, you pay $350, $400 and pay it to the attorney. It's their retainer. No, you can't call them if something happened, you have a car accident. No, you can't call them if somebody, punch you in the face. No, the only thing they are there for is when you are in that hospital and something is to the left, nobody is listening to you, you are worried about your family member. That is when you call them and say, we need you here. Okay. And the reason for that is here in Atlanta, I didn't really do stuff outside of Atlanta, so I can't speak on outside of Atlanta. But here in Atlanta, baby, they are infamous for changing the medical record. I'm going to let that sink in. They are infamous for changing the medical record. I have seen some egregious things, and they will call a team in. They will call the team in, and 3 o'clock in the morning, everybody getting their notes together so that everybody's notes agree. So when you finally call your attorney, when you get out of the hospital, do whatever it is you do, and you finally call your attorney, and then your attorney requests the records, they think your ass crazy. Because that didn't happen. That's not on the record anywhere. What are you talking about? What is she talking about? She was confused. She didn't understand. She's ignorant. Because that's how they like to treat you and think of you as Black women. Because what are you really going to do without having somebody? Because when your attorney comes to the bedside, attorneys talk to attorneys. So that nurse, she don't want no parts of this at this point. She like, nah, you need to talk to supervisor. You need to talk to somebody other than me. She don't want to come in the room no more. The charge nurse is like, she going to call nurse supervisor. Nurse supervisor going to call risk management because lawyers talk to lawyers. If the person was not getting attention up until now, they will be getting attention. They will be getting attention. They will be getting paid attention to. Somebody will be coming to their rescue. And your attorney can say, can I have a copy of her medical record right now? And so they can't change it. And they're entitled to that. And they know that. And they can't change it. So again, you're not looking to run and be like, oh, I got a case. That's not what you're looking for. You're looking for your loved person to be able to survive this damn admission. And if getting that attorney to the bedside is what you have to do in order to get the attention that your loved one needs to survive, you do what you got to do. That's going to be the best $400 you ever spent. Now, best case scenario, you don't need it. Okay, you spend $400. You spend $400 on coffee. You spend $400 on socks. Okay? Best case scenario, you don't ever need them. But the worst case scenario, if you do, you done paid, they right there. Now, everybody, now hold on now. Also, what I'm saying is don't be like, because I'm going to call my lawyer every 2 seconds. That's a red flag for everybody, and nobody's going to want to deal with you. Nobody's going to want to help you. So don't do that. Okay? Don't call the lawyer when you go to the hospital. Like, what she said? Don't make me call my lawyer. Don't do that. It's annoying. It's inappropriate. And the more you say it, the less weight it has. You don't need to say it at all. Your attorney needs to just come up as a visitor and be like, who's in charge here? Yes, Esquire, and run it on in. Okay, don't give people a chance to prepare for the attack. That's just crazy. And I hate to say it like that, but that's what's happening. Again, I've seen some horrific things. And how could you be so, don't even get me started. That's why it's just like, I just had to stop. Because I feel like a lot of times Black doctors won't speak on it because a lot of times, and they try to do it to me too. And this is why I said, I'll get the hell out before I let you do that to me. They were like, oh, we need you to take an angry physician's class. I'm not angry. You're just not going to run over me. I'm not angry. You're just not going to you're not going to make me watch this. And you're not going to do it to my patient. So if that makes me angry, let's have it, sis. But you're not going to do that. And so then they start to try to railroad you, start to try and do little things, start to try to, oh, we got a report. Oh, it was anonymous. Well, if it was anonymous, why are we even talking about it? If they didn't feel like it was important enough to say who they are, then why are we even talking about it? So it was just all these anonymous reports. And I said, I think the reports is from y'all. Like, I don't even think it's who. You cannot. And as much as the nurses, as much as I used to get on their damn nerves, you could not find one nurse who would say I wasn't great at my job. Who would say half of them, their daughters would come to me pregnant. Their nieces would come to me pregnant. They would sneak and come to me because they talk shit about me on labor and delivery floor, but they would sneak and be my damn patients because they knew I was good at what I did. But they run you down a rabbit hole of open your mouth and you're going to regret it. And when you have kids, and I don't judge anybody, I don't judge. You have kids in college, you have $750,000 house you got to pay for. You got two cars you got to pay for. You got parents that you're taking care of. You can't just be jumping on the sword and messing up your money. I get it. I get it. But I I can't watch certain things. I feel like if you watch it and don't say anything, you're a part of it. And I was not willing to do that. I'm sorry. Not sorry actually. But like I said, I don't judge anybody. Where you at, what you doing, that's your business. Your life is your life. I listen, I don't judge. I'm just telling you what worked for me, what works for me. Okay. And like I said, if I couldn't do it and not help and not be a help, I'm not going to do it at all. So for all of the women who cannot come and see me, for all of the people who are trying to get pregnant and want information. They want to know what to do when they finally get pregnant. They want to know what prenatal vitamins I recommend. They want to know what supplements they should or shouldn't be taking. They want to know what to do. They want to know in the third trimester, is my baby moving enough? Well, how do I know that? They want to know how to do fetal kit counts. All the things are here. Okay. Like I said, 7,000 deliveries and no fatalities. And trust me, trust me, all glory goes to God. But at the end of the day, I was there. I was there. And there was some close calls, baby. And there was some times I wanted to pee in my pants and I had to sit on the floor because my hands were shaking once I finally, did what I needed to do. It's a long 24 years. Okay. But at the end of the day, I condensed it all into a book. And I hope it's some midwives and doulas and some younger OBGYNs up on here who are following you, going and get your daggone survival guide. And maybe this will, maybe more people will do what I was doing and all the things, because I'm not a gatekeeper. I'm not, but we do got to print these, so they do cost. So I'm not a gatekeeper. So I want everybody to have the information and everybody to be able to run with it. But again, like I said, instead of y'all spending $400 on those pregnancy photos, and I ain't hating on them, if you got an extra 400, rock out, sis. But what I would recommend is please, 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 please pick up an attorney on retainer. And I guess I'm gonna call it what I say, maternity, what I call it. Anyway, just pick it up. So therefore, if something goes to the left, you ain't gotta wait till you get out of there. Hope you survive. No, right to the bedside. Right to the bedside. You hear me? And when somebody knows that it's gonna be some retribution, they get themselves in line. And I think, to be perfectly honest, that's what we're gonna have to do, if not permanently, for a while, to make sure that we're securing our best level of care, because they're not just going to give it to us. And they know, I hate to say it, but Black women are the lowest equity, because they know you ain't going to do nothing but leave and go and get that stuttering attorney that pick up all the cases for the Black people, who all of a sudden you don't hear about these cases, which I take a little bit of pause in. They probably cut him a little deal or something. I don't know. I ain't saying that, but I'm just, at the end of the day, they give you a little bit of money and they say non-disclosure, so you can't talk about it, and then it all goes away, because that's how our minds work. We're on to something new the next week, and your loved one is still gone. So I hope this helped, guys. Go to, I think, if I'm not mistaken, I think the printed version of this is $34.99, and I think the digital is $29.99. Am I right, Justina? Either way, go to drtasha.com. It is up tonight. Order your copy, if not for you, for your friend, for your daughter, for your sister. It's not just about pregnancy. It is literally teaching women what to do and what not to do in their reproductive ages. And the part when I'm talking about going into the hospital and when I'm talking about going into the hospital, as well as going up the chain of command, if you are having surgery, a hysterectomy, any type of surgery, whatever the case may be, heart surgery, I don't care what it is, do the same thing. Understand how to go up the chain of command. The chain of command is the same. Okay, whether you're on a general medical floor or labor and delivery, the chain of command is the same. And yes, get you an attorney on retainer just in case you need to be heard. You need attention to be paid to you in your case so that somebody who's going to advocate for you is at your bedside, not waiting to talk to you a week after you get out the hospital, at your bedside so they can get the actual hospital notes and not the information that the hospital is changing it to. All right, guys. So I'm be talking about this. Prepare to be sick of me. I am proud of myself and I am happy for y'all. Prepare to be sick of me. Y'all fitting to see YouTube shorts. Y'all fitting to see Instagram ads and posts and reels. Prepare. This is going to be the music. I might be dancing with the book. Prepare to be sick of me. Okay. But get this, when I tell you it is worth its weight in gold, I promise you, promise you, promise you. Get it. If you feel like there's anything that I left out, I want to know that, honey. We can do a second edition if we need be. But I took my time and made sure that, what needs to be seen, heard, and discussed is here in this book. Okay. So again, drtasharogers.com, drtosharogers.com. And it's on there. It's up there. Okay. It's pinned in the comments. The link, I think, or whatever it is pinned in the comments. Y'all know I don't know all these little tech savvy words. People back here doing stuff. And this is what it looks like. This is what it looks like, ladies. Is that? Can you see? Can you see? Can you see my Instagram camera? Can you see? Okay, my YouTube camera. Can you see? All right, y'all. I'm out of here. It is Friday night. I'm not going to hold y'all hostage anymore. I hope that you all got something out of this. So no matter what stage you are in your life, I hope you got something out of this. And I'm prayerful that this helps somebody, if it's even one person, if it saves one life, if it helps one person ask a question that they would not have known to ask, I'm happy. So I hope this blessed y'all, and I will see y'all back on Monday with another video. Not sure what we're talking about, but it will be another video. Have an amazing weekend, and please stay safe. Thanks for joining me, y'all. Bye. All right, in this girl. Okay, so I don't know how to do this stuff. All right, so we're going to end this one. And we're going to end it now. And yes, I got to share it. Okay, and then this one. I don't know how to end it, but... Oh, okay. Ended it, I think. No, hold on. Yeah. Your stream will stop immediately. Okay. End.